Good evening, ladies and gentlemen. I am Jorge ZELAYA and I am a medical practitioner from Universidad Peruana Cayetano Heredia from Peru. And today I'm going to present you clinical, biochemical, and histological characteristics in obese patients with significant fibrosis due to non-alcoholic fatty liver disease. The authors are RUIZ Walter, AGUIRRE VALODY, LOZANO ADELINA, RODRÍGUEZ and I. What is the NAFLU? The NAFLU is the presence of more than 5% of liver steatosis, and this disease is prevalent in the obese population undergoing bariatric surgery and includes two conditions: simple fatty liver and NASH, non-alcoholic steatohepatitis, could be with or without fibrosis. And this fibrosis is stratified in 5 grades, for F0 to F4, and is a fact that the presence of significant fibrosis more than F2 is an independent factor for developing complications associated with hepatic disease and more mortality rates in these patients. That's why this article aims to describe clinical, biochemical, and histological features of obese patients with liver fibrosis due to NAFLU who underwent bariatric surgery. It was done in a private clinic in Lima, Peru, from 2015 to 2019. For this series of cases, we enrolled patients that show significant fibrosis by perioperative biopsy, and then applying our inclusion and exclusion criteria, we ended up with 22 patients, being 54% females with a mean age of 41 and a weight of 115 kilograms. Additionally, in the biochemical features, most of our patients had a higher levels of HOMA-IR and ALT. Also, as we can see on the last graphic, in the histological characteristics, we found a great amount of patients that had advanced fibrosis, and all of our patients showed at least grade 1 of inflammation or ballooning. However, none of these features had presented any significant statistics relations. When we compare it with other studies around the world, Latin American people tend to be younger when they have severe grades of fibrosis, in contrast to European and Asian population. Also, as being stated in many studies, even though there's an increase of the levels of ALT, AST, and HOMA-IR on the severe case of fibrosis. Independently, they are not statistically correlated. Finally, 41% of our population had advanced fibrosis, F3 to F4, a considerably amount of patients compared with other studies. Thank you for attention.